Stephen gave you some of the statistics from last year, but we learned a lot during the Affordable Care Act open enrollment period last year. Now, one of the most important things we learned was that there is a huge demand for access to low-cost, high-quality insurance. By all standards, the Affordable Care Act and the rollout of the Affordable Care Act worked. But having been a part of it and watched it, we learned some lessons. Any new program, any new initiatives, particularly one on such a massive scale, you have to get through the shakedown cruise to figure out what needs to change, how you can improve. One of the things that we were reminded of in that initiative last year is that among the reasons that there are so many people who don't currently have a healthcare home and health insurance is that it's not just about price. It's about, for a lot of people, they just don't know how to go about doing it. They're afraid of the process. They think it's going to be a lot of paperwork. And so when you have the combination of, a fear of sticker shock and then uncomfort or lack of comfort with the process, it keeps a lot of people out. And so even though we put together an extraordinary collaboration and successfully signed up in Houston, in the greater Houston area, 198,000 new enrollees, we still have a large pool to reach. But we learned through that collaboration how to message and how to target. And as we go out for this second round of open enrollment, we believe we can be more strategic and more effective in reaching those uninsured. It did take an amazing amount of coordination among a number of different organizations, and I want to thank again those agencies that Director Williams read off who make up the collaboration. This was a concentrated effort, made a lot of difference. We're going to come back together, and we're going to make an even greater difference in connecting people to necessary insurance, which ultimately leads people to a healthcare home, which ultimately leads people to better health outcomes, which is better for the economy of Houston, it's better for the health of our citizens, and it actually impacts the city's bottom line. A healthier community is better for everyone who lives here. And one of the key elements of having a healthier community is making sure that people have regular, consistent access to health care. And so while the Affordable Care Act, perhaps in Washington, is still controversial, I can tell you that the people who went through the system, who now have health care, who now have health insurance, understand that it's made a difference in their lives. And we're going to come right back in and work to bring more people into the system so that we can transform more lives and, again, contribute to a healthier community across the board. Thanks for helping us spread the word. Again, tomorrow morning we crank it up. Yes, it's a lot of paperwork, but there are trained, sympathetic navigators who will help you go through the process. I am one that hates doing paperwork. I wouldn't want to embark on this by myself, and no one has to. So work with us, and let's, as a community, create a healthier environment for all of us. Thank you.